We know that the infant safe sleep recommendations include sleeping in the parent's room, close to the parent's bed, but on a separate surface designed for infants. There are families who do not follow AAP recommendations, whether it be due to cultural influence, lack of knowledge, or simply a personal preference. But our job as pediatricians is to engage these families in a respectful conversation to both understand their why and provide information on the AAP recommendations so they know what they can do to minimize the risk of sudden unexpected infant death. Parents want to keep their baby safe. The following video will demonstrate how you can navigate a conversation with a patient who mentions that they bed share with their baby. Well, Chelsea is doing beautifully. You're doing a great job with her. Everything checks out on her exam. Let's talk for a couple of minutes. What's on your mind? What can I help you with?
She's sleeping okay through the night, but she only really falls asleep when she's in my arms and I'm holding her. So I've been sleeping with her in the bed with us, just to get her to actually sleep through the night. So is that okay and normal?
Well, look, that's a great question. And if I understand what you're telling me here, it sounds like you're dealing with some sleep deprivation issues with all parents have to deal with. And your solution right now is kind of holding her to sleep in bed with you. And with your permission, I'd like to tell you some things about why I'm concerned about that. And maybe we can look at some alternatives that might be a little bit safer, because we really want to focus on the safety of Chelsea here today. So here are some of the concerns that we have. One has to do with the parent or any adult person or other child being close to the baby in bed. We move around when we're asleep, and even though we like to think that we have control over that, we're unconscious. And so it is possible, and this has happened unfortunately tragically to families, that they've rolled over on top of their babies or just up against them and have covered the nose and mouth, and that's led to a tragic suffocation kind of situation. So we certainly want to avoid that with Chelsea. There are other things within that environment that are just hazards for her that are nice comfort and touchy-feely things for us. So that nice fluffy pillow, that nice thick comforter, your blankets, your sheets are all things if they get close to the baby's face and become suffocation hazards. So we want to avoid those things. So for all those reasons, we don't recommend that baby sleep in bed with the parents. Instead, we want you to room share and have the baby close to you instead.
I follow some people on social media and they actually were talking about baby loungers. And I was just wondering, it seems to really work for them. Is it okay to use a baby lounger?
You know, it's interesting that you bring that up, because in the past year, a new law came out that really restricts what things are considered safe for babies to sleep in. And those loungers are not on the list. As a matter of fact, those loungers are specifically designed for when babies are awake and playing. And you need to have an awake adult supervision in order to use those products. When they're in the bed with you, they're really kind of shallow, and it's easy to roll over top of that, or for a baby to get out and tilt out of it, and then you have all the dangers of being in the bed. So we can talk about alternatives to that. For me, the simplest thing is like a play yard with a bassinet feature. There's some now that have a feature that swivels around, so you can bring Chelsea right into bed with you and do your breastfeeding without even having to lift her up or pull her out somewhere. So any of those would be great alternatives, and even a swivel bassinet that goes in so you don't have to pick her up. Okay. So those are all things that you can use that'll create a safe sleep environment for Chelsea and allow you to sleep knowing that your baby is safe and close to you.
Thank you so much. I really appreciate your suggestions and just letting me know the things that I should look out for.
Well, it's great to see you today. Make sure we get our next appointment set up. We'll see you back for the 4-month shots, and I hope things go better with her sleeping.
Thank you.
You're welcome. Bed sharing is a very personal topic, and this can be a difficult conversation to have with families, but it's an important conversation to have. Pediatricians should keep in mind that people from some backgrounds may have traditions that encourage bed sharing with their babies, so it's important to provide the facts with consideration and sensitivity.